My name is Osman Temukamara. I am from Sierra Leone, West Africa. I am a patient at the Yashoda Hospital. I came in October of 2023 and I am still here January 2024. I came to know about Yashoda Hospital through my sponsor who agreed to assist me following an accident I had in 2020 where I sustained a broken leg and a broken knee. I was treated in a facility in my country. The treatment did not suffice. Later in 2022, I had a relapse, and when I went for diagnosis, the diagnosis revealed that the screws that were placed in my leg had broken. And so I went for further consultation and treatment, but I was referred abroad. My sponsor agreed to search for one of the best hospitals in India so that I can be treated abroad. He came up with Yashoda Hospital. Yashoda Hospital in Hi-Tech City in Hyderabad. I came in on the 15th of October. I stayed in a nearby hotel. On the 17th, the first surgery was done on my leg. 3 weeks later, the second surgery was done on my knee. And I must say I'm feeling a lot better now. How I was feeling when I came in. The treatment was extremely good because now I can almost walk, to be able to walk on my own completely unaided. And the staff are very professional, the doctors, nurses are very professional. Dr. Mohan Reddy is a very good doctor. I can say he's one of the best in the world. He's very professional. He counsels me. He talks about the procedure even before we go to the theater. He tells me about what I am expecting and allays my fears that nothing bad is going to happen to me. And indeed, I went through the procedure without any problems and I am recovering very, very, very well. When I was admitted in the hospital, the nursing staff are very professional. They attend to me on a regular basis. The only issue I had at my first admission was about the variety of food. But when I raised that issue in my next admission, I was given a lot of variety. I was very impressed by their response. Whenever you raise an issue, it was adequately addressed. Quite apart from the food, I had no other problems. The treatment was exceptionally good. The staff are professional and excellent. And I must say a very big thank you to Mr. Ashok Kumar, the manager for international patients. I don't know if that's the correct title. He's been very, very, very responsive of my needs. Whenever I contact him on any issue, he'll always be there for me. He schedules my appointment with the doctor. He always sends me a vehicle to pick me up from my hotel to the hospital and carry me again. He's been very professional. Dr. Ram Mohan, I believe, is one of the best doctors, orthopedic surgeons in the world. I can vouch out for that. And I must say, Yashoda Hospital, to me, is one of the best in the world. Their facilities are top-notch. Their staff very professional. And I'm so far very satisfied with the services. If anybody is seeking professional healthcare treatments, I'll recommend Yashoda Hospital at Hi-Tech City in Hyderabad, India. They treat a variety of ailments. I came for orthopedic surgeon, but by the look of things, their diagnosis is top-notch. I was tested virtually for everything in my body. The heartbeats, the liver function, the blood, the urine, everything absolutely, and they gave me the results. So I would recommend anybody seeking high-quality professional treatment to come to Yashoda Hospital, Hi-Tech City in Hyderabad. One thing I would like to add is that I want to thank my sponsor very much for choosing Yashoda Hospital. He made the right choice and he ensured that I got the professional treatment and top-notch treatment that I desired. My foot was almost deformed. When I came, Dr. Mohan Reddy assured me that I'm going to get the normal shape of my foot. Now it's very normal. My foot is very, very normal. And the pain keeps subsiding every day. Every day the pains keep subsiding down. And I know in a matter of weeks or probably a month, I'll be able to walk on my own. So I'm very much satisfied with the treatment that I received at the Yashoda Hospital. To me, it is one of the best hospitals in the world.
Hello, I am Dr. Mohan Reddy, orthopedic surgeon at Yashoda Hi-Tech Hospitals. I mainly deal with lower limb surgeries like hip and knee replacements as well as complex trauma and corrective surgeries. Our business development manager, Mr. Ashok, showed me a couple of x-rays few months ago. They were of Mr. Usman Taimu Kamare, who is 48 years of age and comes from Sierra Leone. His right femur was fixed with a nail after he had a major accident on the highway. The nail was in a wrong place. The screws were broken and there was deformity at the fracture site by about 10 to 15 degrees varus. There were further problems down the leg. His proximal tibia on the right side was fractured, what we call Schatzker type 5, with both the condyles broken and they were in the wrong place. The fractures had healed. There was malunion with about 15 to 20 degrees of varus deformity. Mr. Kamare was not able to walk because of pain as well as deformity of the knee joint. His right lower limb was short by about 3 to 4 centimeters as compared to the left side. Before I saw Mr. Kamare, we had a pre-op planning. We got a detailed plan that there should be CT scans that will show the extent of deformity and what needs to be done. Mr. Kamare arrived to Hyderabad few months ago. We had very detailed discussions with Mr. Kamare. When Mr. Kamare came, he was under the impression that he would get both the surgeries, the right femur and the right tibia, done at the same time. I discussed with him and I explained to him the complexity of the surgeries. I also told him that as a first stage we will do the femur fracture fixation, and once the fracture heals in 3 to 4 weeks time, then we'll go to the next step of right knee deformity correction. Having understood the nature of the surgery, Mr. Kamare kindly agreed. The femur fracture, which was fixed with a nail, was done first. The broken screws, some of them were removed. The nail was removed. The deformity, which was in 15 degrees varus at the fracture site, was corrected and refixed with a proper nail. Post surgery, we made Mr. Kamare walk as comfortable, weight bearing. Few days later, he was discharged. We regularly followed him up for 3 to 4 weeks. After the wounds healed and the x-rays showed good amount of callus formation, we discussed again about his right knee surgery. There were initially two opinions, whether to do a total knee replacement or whether to do a corrective osteotomy. After seeing at the CT scans as well as MRI scans, I explained to Mr. Kamare that knee was not arthritic and therefore there was no need for knee replacement. His ligaments were good, so there was no need for ligament reconstruction. The knee was in 20 degrees varus deformity. All it needed was a proper osteotomy, what we call HTO, high tibial osteotomy. It involves breaking the bone just below the knee joint, correct the deformity and fix it with a plate and synthetic bone graft. The plan was executed properly, and post surgery we could see that his leg deformities were completely corrected and the leg lengths were almost normal. He is now 4 to 6 weeks post surgery. He is able to walk, there is no pain, and the x-rays show satisfactory healing at the high tibial osteotomy site.